I'm Dr. Rhonda Mough, and I'm an obesity medicine specialist and bariatrician here at Novant. I decided to focus my practice on bariatrics and obesity medicine after spending a number of years as a primary care provider and really seeing the impact that weight can have on patients' health, and that it can be one of the root causes of a lot of other medical conditions. And so being able to focus on what one of the underlying problems is with a lot of these medical conditions and getting at that root cause can help a lot of other health conditions improve. And it's really rewarding just to see those types of improvements, not to mention improvements in quality of life and mental and emotional health for a lot of patients that have dealt with their weight for a long period of time. It's just very rewarding for me to see all of those improvements in helping them go along their weight loss journey. We have an in-house dietitian. We have a social worker who assists with therapy, with patients with eating behaviors and helping them improve those aspects. And then we also offer my services in obesity medicine as well as bariatric surgery. A lot of times patients feel that the reason they can't lose weight is because they don't have willpower. And the fact of the matter is that obesity is a chronic medical condition that requires lifelong management. And the difficulty in losing weight and maintaining that weight loss is actually biologically driven. There are strong forces at work that are fighting against people whenever they're trying to lose weight and get below their weight set point and keep that weight off. Patients often feel that once they get the weight off, it will be easy to keep it off. And while I wish that was the case, unfortunately for the same reasons, because of biology, it can be really difficult on their own to lose that weight and maintain that weight loss. And so that's why having support of professionals who deal with these sorts of problems on a daily basis can be really helpful for patients in achieving their goals. There's a lot of information out there, and it can be really tough to sort through it all and figure out what is best. And what's best for one person isn't always best for everyone. So getting that individualized guidance and approach to nutrition is really important. Nutrition is a cornerstone of any effective weight loss strategy. So I really encourage patients to speak with a dietitian about what's right for them. We always want to try to choose meals and snacks that are balanced, that contain some protein, because protein helps with hunger control. And then also with some fiber and some healthy fats. And those aspects of diet can help us feel more satisfied after we have a snack, so we're not looking for something again in an hour or so. And again, talking with dietitians about those macros, as we call them, macronutrients, and where to find them in our diet and what healthy sources are, can be really helpful. I always try to get a sense of where they are with their physical activity. If they're just starting out, sometimes just setting a step goal. There are lots of trackers out there available now, so people can get a sense of what their daily step count is and then set a goal above and beyond that and work toward that. If they're already doing some exercise, we look at different types of exercise, cardio exercises with cardiovascular conditioning versus strength training, resistance exercises, and really trying to incorporate both aspects because there are benefits to both being used together. Our bodies kind of get used to certain activities. We get into the groove of doing a certain type of physical activity or eating certain foods kind of on repeat. And sometimes if we just mix it up, it can jumpstart things. Sometimes tracking our food intake, looking at our protein intake and things like that to see whether or not we're meeting goals or if we need to make some adjustments. Or looking at exercise, not only changing the type, but maybe how often we're exercising or how long. And if all else fails, then certainly coming and talking to someone can be helpful, because maybe it's a time to talk about medications to assist with weight loss or other strategies. Maybe there are behavioral strategies that could be helpful as well in terms of eating patterns and things like that. So just reach out and ask for some help if all else fails. There are situations where medications are appropriate for patients who are trying to manage their weight. Patients who have tried a lot of other interventions, they've done a healthy diet, they're exercising, and they just are not seeing any weight loss. Or in patients who have significant weight-related chronic conditions for which losing weight can be beneficial to their health. Weight loss can be up to 15 or 20% in some patients on these medications, and so for patients whose health conditions warrant that degree of weight loss, medications can sometimes be a good option for them. We are a great resource for patients who just need or are looking for a one-stop shop for where to find the services they need to help them manage their weight and improve their health. We pride ourselves on kind of having a family atmosphere here, and I think that patients feel very comfortable coming here and allowing us to be part of their journey. So I would just say you are not alone, and please reach out to us and we're here to help.